Let's be honest, modern medicine is broken. Patients are dismissed, doctors are exhausted, and mental health care is decades behind. So it's time to disrupt the status quo, to challenge a system that fragments care, dehumanizes patients, and burns out clinicians. I'm Dr. Georgine Nanos, and this is The Kind Revolution, a podcast about breaking old paradigms, rebuilding medicine with compassion and science, and reimagining what healthcare can be when we finally get it right. Because change is here, and it's starting with us. Welcome to the revolution. Welcome back to the Kind Revolution podcast. I'm your host, Dr. Georgine Nanos, and today we're doing something a little bit different. I've invited my colleague, our Director of Marketing and Operations here at Kind Health Group, the fabulous Lauren Luscombe, to join me for a special Ask Me Anything episode. Lauren has collected all of your questions from our listeners and from the community, and today she'll be putting me in the hot seat. I don't even know the questions. She's just going to fire them off. So everything from medicine to mental health to big questions you've always wanted to ask your doctor, nothing's off limits. Let's dive in.
Super excited to be here. Thanks for having me. We compiled from Instagram. We put a little box up front, had people write in questions, and they all seemed super excited to kind of get your take on a couple of different things. We'll start with one that I feel like I kind of hear you talking about all the time, but it's always really good. What are the top 3 things you wish every patient would do for their health?
Oh my gosh. I have like a top 33, but the top 3 I would say would be to advocate for their own health, is especially for women, is to speak up and be heard, and know your body best. So advocating for your health, and then actual things that you can do. Getting sleep. Sleep is the most important thing. I'm going to do 4, and then eating whole foods, avoiding ultra processed foods, and then exercise. Exercise is one of my favorite things to do. And that's 4 things. So I will stop now.
All super important. On the topic of sleep, the next question is, how much does sleep really matter compared to diet and exercise?
I'd say sleep is number 1 for sure. Without sleep, everything else falls apart. It's really critical. And then I'd say that sleep, diet, and then exercise.
This one's interesting. Are annual checkups actually necessary if you feel healthy?
Yes. So here's the thing. The problem with our current healthcare system is that it's very reactive. And so everyone thinks like they only should go to the doctor when you're sick. And it's in fact the complete opposite. You want to go to the doctor so you can focus on staying well. But our system is not built around that. It's in fact, the whole system is designed to only pay doctors for visits that involve problems. And so that's how the insurance company has designed it. So the annual wellness exam, like an annual physical, technically is supposed to be there to help with preventive care. And so people don't know this, but that's the whole point of an annual exam, is to go there to talk about your preventive screenings, whether it's pap smears, mammograms, colonoscopies, PSA tests, whatever you need, and to address those concerns about prevention. Now, most people see that as an opportunity to go and discuss like a laundry list of other things you have going on. And while that happens regularly, it makes it really challenging for doctors and providers to take care of everything in one visit. So ideally, if you do have other stuff going on, it's better to make separate visits for those other actual items so that they can be acted upon and addressed in with more time and space. Typically, a doctor has maybe 15-20 minutes max to talk to you. And if you've got a lot of issues that need exploring, you're best off setting up multiple appointments. But here at Kind Health Group, we flip the model completely around. We focus on prevention. We are all about making sure you stay healthy, and we like to see you all the time and talk to you constantly. In fact, our favorite tradition every week is we get together with our whole team every Monday at 10 a.m. Everybody's together, and we talk about every single concierge patient in our practice. We talk about what's going on with them last week, what happened this week, what we can anticipate is going to happen the following week, what they need. And we have like a punch list of things that we are doing for those patients constantly. Patients love it. We love it. It keeps them healthy, keeps them out of the hospital, out of the specialist's office, and leading a very happy and fulfilling life. And it's really makes me happy too.
Those Monday meetings are my favorite too.
Yeah.
All right. What is one underrated screening test people skip, but they shouldn't?
I would say the colonoscopy is something that people like to skip because it seems so difficult. I always joke that a colonoscopy is going to be like your best day ever because you're going to lose like a few pounds. You're going to take a really, really good nap, and then you're going to be high for the rest of the day. So, it's really like a triple win. And you'll have a clean bill of health for 10 years. That's pretty good. Colonoscopy, very passionate about making sure everyone gets those done. There's no reason anyone in the United States should have colon cancer. That is the best screening tool we have. It is so effective. No one should be dying from colon cancer if you're getting your colonoscopies starting at age 45. Mammograms also critical starting at age 40, pap smears as well. But then I think the other thing, I'm going to kind of revise my opinion on this. I think the number one screening would be for cholesterol testing early on in your life, starting in your 20s, so you know your risk status, and not only checking just your basic panel, but looking at the lipid NMR and looking at a much more comprehensive view of the cholesterol in your system, and then also doing advanced cardiac biomarkers like lipoprotein little a, apolipoprotein B, and those also confer independent risk aside from the other cholesterol tests that you're doing. So yeah, that's a lot. That's a lot. So I would say cholesterol screening and then colonoscopy, mammogram.
If for all of our listeners right now, if you haven't already read Dr. Nanos's blog post on cardiac testing, it's on our website and it's linked on our Instagram. And I highly recommend it because it is a phenomenal article about her own personal experience with that.
I remind our listeners that people really dismiss heart disease, but really, heart disease is the number one killer for men and women in the United States, more than all cancers combined. So, really, really important to stay on top of this, know your cardiac risk, and do what you can to modify that risk as much as possible.
The next question is, do vitamins and supplements really work, or are they just mostly a waste of money?
So that's an it depends answer because it depends on what they are. There are tons of high quality and good supplements that you need, but my general rule of thumb is there's no medicine more powerful than what's at the end of your fork. So if you're eating a very whole foods diet and avoiding processed foods, you're generally going to get a lot of nutrients from that. That being said, there are some supplements that are helpful. Vitamin D, we supplement quite often. Some of the B vitamins as well, B complex vitamins. Magnesium is helpful for some conditions, as well as fish oil. There's a couple of others. Here's the sometimes the disconnect that we see. Patients may need, say, a prescription medication. I'll give you the example of red yeast rice, which is a naturally occurring statin, lovastatin. And so patients who may have high cholesterol need a statin, but they don't want to take the FDA approved statin. They want to take the supplement. The thing with supplements is they're not regulated in any way. And so there's no quality control over what's happening from batch to batch and what the actual active ingredients look like. And so I would say I would prefer that patients take medication, and anything you're putting into your body. Supplements are still made in a lab. There's nothing that makes them necessarily more healthy than an FDA approved product that's been more rigorously tested. So you just have to be careful. It's an important conversation to have with your doctor. It's important to list all your supplements when you're going to the doctor's office because a lot of them can sometimes interfere with medications that we may want to prescribe. And the other thing that I see quite a bit, at least a few times a year, is patients taking so many supplements. I mean, Instagram is just full of like supplement push, and it's a hard sell. And when you're like doom scrolling at night, you're like, oh, yeah, maybe I should take these 50 supplements and I'll feel better. But what happens to a lot of people is are taking so many supplements that have to be processed by your liver. They end up getting liver toxicity. And I had one very close friend of mine that did this a few years ago and ended up in the ICU with liver failure. She recovered, and we see this all the time. Less is more, and that goes with medicine and supplements. Healthy diet is key, and talk to your doctor about what you're taking. Not just because it's a supplement doesn't mean it's safe.
Yeah, and on that note, because I know you and I have had this conversation a ton of times, is there a brand of supplement that you or like vitamins that you feel are more authentic or healthier than
Yeah, yeah.
others to
Oh,
take?
absolutely. Yes. My favorite is the brand called Pure Encapsulations, Pure. It's usually a white bottle with blue labeling. Those are the only supplements I would purchase.
Yeah.
Make good, and they also make like good probiotics as well.
What is your stance on alcohol and moderate drinking?
I love I love a good glass of rosé, like any middle-aged North County San Diego mom.
Yeah.
But I it's alcohol in moderation, and I wouldn't even say in moderation. I would say like a minimal amount of alcohol is really best. I know like the recommendation for many years has been like, one glass for women per day or two glasses for men. But I think even that is something we have to be careful about, especially as we age. Everybody's different, and their threshold for what their body can handle in terms of alcohol changes over time. And you don't know what that threshold necessarily is going to be for you. So I personally try to drink as little alcohol as possible. I don't drink during the week at all. If I go out on the weekends, I will have maybe one drink, per night. But I'm notorious for having like nursing the same glass for like the entire night. And it's just something that I don't feel good in the morning. And as we age, that becomes harder to recover from in the morning. It really affects your sleep quite a bit. If you can do as little, I mean, I understand in social settings you feel like you might need to do that, but as little as possible. So that's my take on it. I'm all for a good time every once in a while, but I think on the regular, very, very rarely.
Kind of going into some mental health focused questions. Why does it feel like everyone is more anxious and depressed these days?
Well, that's a loaded question. We're living in a crazy, crazy world. It's crazier than ever before, and it seems to get crazier every day. And so, not only is our outside world, really chaotic, we have, a lot of political divide for people that's very upsetting, and people take very, very personally, which I understand, and they internalize all of these things that are happening in the news, and that creates a lot of stress for people. So my recommendation on that piece of it is to really just absorb as little of that as possible. I know we want to stay aware of our current events, but the less you can really spend time on that, the better for your mental health. So that's number one. The other thing too is, social media and Instagram in particular create these kind of artificial worlds that we're all constantly comparing ourselves to. And that can create a lot of insecurity, anxiety, depression, like I'm not good enough. But we have to remember that that's all kind of made, it's not made up, but it's curated, I should say. So it's highly curated to project a certain image. And so that's another thing that we have to be mindful of. And then, day to day, life's getting more expensive, it's getting complicated. Everyone's going through different stages in their lives, whether you're raising kids, having kids, kids are out of the house. Any parent out there knows that like the job of being a parent never ends, whether your kids are in diapers or in college. The problems are just different. And so that creates a lot of stress. Our own health problems can create stress, and then aging parents also can create a lot of difficulty in our lives that present a lot of stress for us. And so all that coming together can really wear on us. And one thing I was saying to someone the other day, like social media is like the opposite of social. It just makes people feel a lot more lonely. And so we've lost a lot of that interconnectedness, that human connection that we really need. People have become much more isolated, especially since the pandemic, and that's a huge, huge problem. Social connection is the fabric that keeps us all together and that keeps us feeling sane and grounded. So I think finding more of that in real human interaction would help a lot more people.
Yeah. I mean, I agree with you too on the social media aspect. I think too, it's really easy to compare yourself to somebody else on social media. and think, wow, they have this amazing life. And then it kind of makes you feel like, well, what am I doing? And I feel like it's kind of this like domino effect.
Oh, it's terrible. I Same thing happens to me. I mean, I just second I start scrolling, I'm like, "Oh god, I gotta stop this," because you fall down this rabbit hole and you're like, "My life's a shit show.
Yeah,
Why can't I be like that?" But
exactly.
yeah.
Yeah. What is the best way to support a friend or family member who's struggling with mental health?
To be a good listener, I think is really key, and to be there for someone and sort of hold that space for them. It's asking questions, observing. So if you have a friend or a family member that you see is struggling, you want to be able to open a dialogue, and they may not respond right away. And especially same with children and teens. I think this is a particularly tough area if you have teenage children or young adult children that sometimes can become sort of withdrawn, and you think like, okay, they don't want to listen to me, I'm their parent. They're teenagers are constantly annoyed if your parent asks you a question, but they are truly listening and they want to be asked questions. When or how they're going to respond is kind of up to them, but knowing that you're asking and that you're concerned opens that door, and eventually they will reach out to you. So, and the same goes for your friend circles and other family members. And if you feel like someone is really in danger, potentially wanting to hurt themselves or feeling suicidal, ask that specific question. I think people have this misconception that if you ask the question, "Hey, are you thinking of hurting yourself?" that it plants the seed, and that is just really not the case. And in fact opens the door for that conversation, and it's really important to have those dialogues with everybody.
What do you recommend instead of turning to Google at 3 a.m. when you are spiraling?
Spiraling on what though? Like on like a medical issue, or just like or I just woke up.
I mean, maybe. Yeah, maybe they're going on WebMD. They're asking ChatGPT all of their innermost feelings.
Yeah, put it down. So I'm a notoriously terrible sleeper, and I've tried really hard over the last year, and this has really worked for me. Is when I wake up, if I wake up in the middle of the night, I do not touch my phone. You just can't do it. So to put the phone down, it can wait till morning. You're searching about a medical condition, obviously, that's a different story. But I think if you have a good relationship with your doctor, it's someone that you can reach out to. Like all of our patients can call me, text me anytime. So text me in the morning and ask me. Generally, yeah, avoid the Google at 3 a.m. Nothing good will come of it for sure.
No phone. No phone.
No phone, no phone. I mean, you had a good policy of keeping your phone out of your room.
Yep. It lasted like 24 hours, but it's the
I know.
intent is there.
Yeah, I can't keep it out of my room, but I have to say I'm very proud of myself. I have not, like, because what I used to do is if I got up to pee or something, then I'd come back. I'm like, oh, let me just da, da, da. And then like next thing I know, it's 2 hours later, and I'm like, so yeah, no more of that. It's helped tremendously.
These ones are kind of like hot topics that are going on in the world right now. I'm
Okay.
sure you can only imagine. But the first one is, are GLP-1 medications like Ozempic safe for long-term use?
They are. They've actually been around for over 20 years. People don't realize that. Even though they've just become very popular in the last 4 or 5 years, they've been well studied, and there's lots of evidence to support their efficacy and safety over a very long time. I personally am a huge fan. I think I've mentioned this before. Like I've lost over 50 pounds on GLP, GIP, Manjaro, and for me, it's been life-saving for me. If I had underlying cardiac issues and really needed to get down to my most optimal weight just for save my own life, I can't imagine what it would have been without those drugs. So it's not just always about vanity. Although I look really good, so I like that too. But yeah, no, they are safe. Obviously, you want to, the thing right now is they are so popular. People are oftentimes getting them from just anywhere. I mean, I think they sell them in the back of nail salons. They sell them in the back of nail salons now. And I think it's important to make sure that you're getting those medications from a trusted medical provider who has a comprehensive plan of care around that. Who, and here at Kind Health Group, we look at all of your labs before we even do any of these medications or administer any of these medications. We make sure that we're optimizing your health in every other way. We're checking in on you every single week. There is a lot that goes behind it to make sure that you're supported from a medical and safety standpoint. So I think that part is the most important piece of it. And that goes for anything that you're doing. Making sure that you're having solid medical advice behind it is what's going to keep you safe.
What are your thoughts on microdosing the GLP-1 injections? Is it effective? Is it risky? Like, for example, if someone's, a lot more sensitive to the medications than others?
Are you asking for a friend?
Yeah, totally asking for a friend.
I think it's totally fine, but if you if you're not seeing results, you're going to probably have to ramp up your dose until you get, I think when you get to your excuse me, your maximum weight loss goals, then you can start microdosing to maintain. I think microdosing before you get to your goals doesn't make any sense because you're never going to actually get there, friend.
Yeah. And do you want to just touch a little bit on kind of how we do our weight loss program here with the Emsculpt Neo, kind of combining the two and why that's so effective?
Yes. So here at Kind Health Group, we have a lot of other modalities to help people optimize their weight loss and their lifestyle and their health. One of the two tools we actually use, one of the main ones is Emsculpt Neo, which is a device used for body sculpting and contouring. And so we have found it helps reduce fat and improve muscle in the core area, in the waist, really anywhere on your body. So we have seen great results when we combine the GLP-1 injections with Emsculpt Neo. And not only are you getting rapid weight loss, but you're also building back that muscle. One of the big issues with the GLP shots right now is that you lose muscle as you're losing the weight. And so what the Emsculpt Neo does is build back that muscle in a really effective and rapid way, so that you have a strong core. You can build that muscle back. We also can treat the arms and the legs as well, and the thighs, and it's been a lifesaver. So that's key. The other component that we can add in is the ExoMind, which is a device. It's a TMS device that we have here that also has been shown to regulate your mood and your emotions, and it helps control cravings as well. It also helps some of the underlying issues that affect why we overeat. Anytime we're eating too much, drinking too much, smoking too much, whatever it is, you're usually self-medicating some underlying anxiety or stress or something like that. So if we're not treating that underlying issue, then you're just really slapping a band-aid on it. So we're looking at taking care of everything that plays into why we eat too much. And ExoMind is a big part of that. And so if we can attack it from the mindset, the muscles, and then the actual fat loss and weight loss, you're really treating the whole body. And it's so exciting to see those transformations.
Yeah, absolutely. Should people be worried about Tylenol and the autism claims in the news? I know you
Hell
just went
no.
on I know you just went on KUSI and you talked about it. It was an amazing interview. But yeah, just curious on
No,
expanding your
no,
thoughts.
absolutely not. Frustrating and sad, I think, for the entire, I can speak for the entire medical community to see these things happen. There's absolutely no science behind it. People have dedicated their lives, decades of scientific study to look at these questions and examine these questions. And there's no causal relationship, meaning there's no cause between Tylenol and autism. There's an association, meaning that if two things are happening at the same time, doesn't mean they cause each other. I gave this example, like in the summer, the rates of eating ice cream go up. In the summer, the rates of heat stroke also go up. They're both caused by the heat, not necessarily by each other. So eating ice cream does not cause heat stroke. And so that's kind of what's happening here. There's an association. You have to look at why um why are people taking the Tylenol? Are they treating a virus, or what's going on in that situation? And then the risk of not taking Tylenol when there's a high maternal fever also presents a serious problem for women. So it makes me really it's frustrating to see this happen, especially to women, because when they're pregnant, they're in such a vulnerable state. There's already a lot of anxiety and stress around being pregnant for many women. And to do this to them just is sad. It's really upsetting to me, to add this doubt, uncertainty, and fear. And then the other piece of it is for moms who have autistic children and to now feel guilty and have be shamed and blamed for potentially, every woman has taken Tylenol when they're pregnant. And so to have this now be something that they're thinking about and feeling guilty about is awful. It's awful. So, to all the women out there who are feeling that way, you are good. You didn't do anything wrong. This is all just false information.
Yeah, thank you for that. What is your take on biohacking trends like cold plunges, wearables, or hormone therapy? It's kind of like
So
a
those
three
are all
question.
that is a
Yeah,
three question.
I
Those are
know.
all really, really different.
Yeah,
Cold plunges are I know you love a good cold plunge.
I love a cold plunge.
I'm like a warm girl. I love a good hot plunge.
Yeah, a
But
sauna.
I love a sauna. I love so I think if it makes you feel good, then do it. There's no harm in a cold plunge, except unless you have a heart condition. In that case, stay out of the cold plunge. But there's a lot of evidence to support cold plunging for inflammation, reducing inflammation, overall stress reduction. I wouldn't do it more than 6 minutes. There's no evidence beyond doing it for more than 6 minutes. So 6 minutes is really the max. After that, there's no added benefit, and you can potentially do some harm if you're in there a super long times. 6 minutes max on a cold plunge. I think it's great if you like it. If you don't like it, just don't do it. What was the other one?
Wearables or hormone therapy.
Okay, let's tackle the wearables. So I got my Apple Watch. I wear
I
that
have
all
my
the time.
My Oura ring.
And so okay, here's the thing. So I had an Aura ring for a long time, for 4 years, and I loved it. I still love it, but I found that it was stressing me out. So I stopped wearing it. I think I stopped wearing it at the same time that I stopped looking at my phone in the middle of the night because I felt I was like too technology attached. I don't wear my Apple Watch at night. So I'd get up, I'd like look at my phone, then I'd look at my progress of my sleep on my Aura ring. I'd see it was like total shit. And then I'd get upset. Or like, and sometimes it wasn't accurate. And that would stress me out. It would say, like, oh, you only slept 3 hours. And I know I slept 7. And then it's like messing with my head. I think you have to take that information with a grain of salt. And as long as you can, sometimes all of that information, I love data. I mean, I'm a total science nerd. I love as much data as possible. But if the data is creating anxiety and stress, then put it away. So it just depends on your personality, what you're looking for, what you're looking to get from it. There's so many great wearables out there. I love the glucometers. And that's the other, there's a mixed bag for all of this stuff. So the glucometers are great. If you don't have diabetes, wearing a glucometer for a couple of weeks or a month gives you a lot of insight I'm talking about the continuous glucose monitors. It gives you a lot of insight into how food impacts your blood sugar. And I think it's very illustrative and informative for people. However, we have patients that are like chasing blood sugars every 5 seconds, eating candy if they see it go down. And so it's all about an individual decision and how it impacts you and your behavior. So it's good and bad,
Yeah,
mostly good. And
and
then
hormone
hormones.
therapy.
Okay, so this is a whole nother topic. So hormone replacement therapy for women for many, many years has been something that was not advocated by the general medical community because we were basing our information on a flawed study from 2002 called the Women's Health Initiative that made it that gave us the idea that hormones were potentially dangerous to women. We now know that that study had some flaws to it. They only looked at women over 65, and we're not looking at younger women and early intervention of hormone replacement therapy. We now know that replacing those hormones at an earlier age, when appropriate, when discussed in combination with a a medical expert who can look at your individual risk. It can be very beneficial for women. Perimenopause can start for women in their early 40s, sometimes even their late 30s. And it can create feelings of irritability, mood changes, rage, sleeplessness, hot flashes. The list goes on, and anxiety and depression as well. So often, and what happens is our estrogen levels drop, and these hormones are also affect our neuroendocrine hormones as well in our brains. When your estrogen levels go down, estrogen supports serotonin. So you also see a dip in serotonin. Similarly, when progesterone goes down, progesterone typically supports GABA, and GABA is a calming hormone. So that also starts to go down. So you've got these mood hormones also affected by the loss of estrogen and progesterone. So it's all this perfect storm that can create a lot of issues emotionally and mentally as well as physically. So when we're replacing estrogen and progesterone and testosterone for women, testosterone is also an important additive in the hormone balance because it helps us with drive and energy. And so when we're doing that in the right combination, it can really help women feel like they've got a sense of themselves back and their life back in order. They can sleep better, they can function better, they can be less angry. So all of it works really, really well. But the important thing is to make sure you're seeing a provider, a medical provider who knows what they're doing, who's really looking at your individual risk, who's very, very well trained. And that's what we do here. And we do it really well. So I'm excited to be able to offer that to so many women.
Yeah. This next question is probably I wish I would have asked it, but I'm really excited to ask you about it. But I do want to give some context first for everyone. A fun fact about you is that you're probably one of the most tech savvy people I've ever met. I know I've told you this before, and every single time you're like, oh my God, that's the best compliment I've ever gotten. But it is true. And you are so savvy with AI, which is crazy. I mean, I think when ChatGPT first came out, you kind of had to like influence me to get on board with it. And I know we kind of like nerd out with AI. We're always finding new websites and sending things to each other. This question is, do you see a future where AI replaces part of what doctors do?
No, I don't. I actually don't. I think what AI is going to do, and it is already doing, is helping us get smarter and better at our jobs. And that's because kind of getting back to that human connection thing that we were talking about, like there's so much more to being a doctor and interacting with a patient than just the information that is being delivered to you. Most favorite thing about being a doctor is sitting in a room across from a patient and having a conversation and listening to them and really getting to hear their story and the nuance of being in that room and how the energy that people are putting out when they're talking, how they're sitting, what they're saying, how they're saying it, and then examining them physically there. That is something that AI can't do, at least not now, and interpret it in a way that I think a human doctor can. And it's one of the privileges of being in medicine is having developing that deep human connection with my patients. I love my patients. To me, they're all like family, and I hope that that is not replaced, at least not in like my lifetime. Maybe later, that's fine. I don't think it will be. I think it will only enhance our ability to take better care of people and to solve more complex problems. And that's what I'm hoping for. But yeah, I love AI. I use AI all the time. I'm always looking for new ways to use it. And I think it's an exciting time in medicine, not just for AI, but also for other advancements that we've seen just in the last few years. Our ExoMind TMS device, energy based devices are really the future of medicine as well. We can do so many things for people in a non invasive, safe way. So I love technology, as you know, and I'm excited for more to come.
Yeah, I agree. I think AI, it makes people it makes hard workers work harder. It makes smart people smarter. I do feel like it could make lazy people lazier. We've talked about this. You have to know how
Sure.
to use it, you know?
Yes. Yeah. So this is what I tell my kids. So I think if you're already a subject matter expert in something, it will only help you expand your knowledge base, and then you can critically assess what is being spit back to you. So, if I ask AI a question and it looks like garbage, I will know it's garbage. But if I am not a doctor, if I'm not someone who knows what they're talking about and it spits it back, you can't interpret that. You can't assess it. And so I say the same thing for kids and teens who are using it in school to write papers. Like, you don't even know like if any of that coming out is true or not. And so you have to be very careful about how you're using it and what you're actually learning from it, if it's expanding your knowledge base or making you dumber potentially. That's the danger, I think, for young people. If they haven't already learned how to think critically and gotten expertise in certain subject areas, then it's not doing them a service.
I totally agree. Let's see here. All right. What is something you wish more women knew about menopause?
Gosh, so many things. I wish more women knew that we're all in this together and that there is so much that we can do to help, like so much. Like we can make it, I would venture to say, at least 90% better than what you're feeling right now. And so I think to reach out to providers who are willing to take the time to listen is really key. There's still so many providers and doctors in the traditional practice of medicine who are, in that every 5 to 10 minutes seeing patients 20, 30 a day. They don't have the time always to dig deep and to help you determine what's best for you, but there are other doctors that do. We certainly do. And seeking those people out is really key to making you feel better and feeling like you have your life back. It's all fixable.
On the note of speaking to your doctor, our next question is, how do you know what's normal versus what you should get checked out?
For what in particular?
I think they're speaking in terms of like menopause. Like, do you know if this is like a normal symptom of menopause and, when you should get checked out is what I'm assuming they're talking about.
Oh, probably the number one thing to be concerned about is if you're in menopause, meaning like you have had no periods for over a year. That's the technical definition of being postmenopausal, meaning you haven't had a period for over a year, and then all of a sudden you start bleeding. That's a potential concern. That's a red flag. That is not normal. So you need to see someone right away for that. Um, if you're having serious mood disruptions, anxiety, depression that's interfering with your daily function, you can't get out of bed, you're having thoughts of hurting yourself, not normal. I mean, that's something, again, that needs immediate attention. And then, hot flashes and other symptoms that are interfering with your daily life. You can't sleep. That is a big deal. It's normal to have some of these symptoms during menopause, and they can happen commonly, but they become red flags when they're interfering with your daily function and your ability to live a fulfilling and joyful life. So that's the goal. And
Yeah.
if that's stopping you from getting there, then it's something that needs to be addressed.
I also feel like it kind of has to go with intuition too, right? I mean, like if you feel like something is happening and you just
Yeah,
want to make sure, it's like call your doctor. But I know sometimes our healthcare system isn't set up that way. It's like, oh, okay, I'm going to call my doctor to make an appointment. Okay, there's an appointment 6 months from now, you
right.
know?
Right. Yeah.
Yeah.
Or your doctor will be dismissive and say, "Oh, you're fine. Your labs are normal. You're okay. Suck it up. It's just normal aging." And again, there are other solutions that we can provide that go beyond that sort of platitude that a lot of women get.
Yeah. What is the most common medical myth that you wish would disappear?
There's this idea that doctors are like all about big pharma and pushing pills and that we make money when like we're pushing pills. That is so not the case. I've never seen a dime from a pharmaceutical company in my whole life. I mean, I wish, but no. Uh, so uh, I think that is a big misconception for people. It's the insurance companies that are really the problem. So doctors are not out. First of all, anyone that goes into medicine is not in it for the money. They're way sure, doctors make good money, but there are way easier ways to make money. 99% of doctors are doing this because we genuinely care about people. We genuinely want to help people and are in this system that makes it very challenging for us to do that. Our we took this oath, all of us, when we finished medical school to do no harm. And we take that so seriously. I wish more people knew that doctors really, really care. And sometimes if they feel like you feel like they don't, it's because doctors themselves are facing a crisis of burnout. We are in this system that is just crushing the souls of so many doctors in that traditional model. That's why I left that. I love practicing medicine so much. Like I always say, I love it with every fiber of my being. And I knew if I stayed in that old model, I wouldn't be able to do it for the rest of my life. And that's something I really want to do. I want to practice medicine until the day I die because I love it. It's not work to me. It's not a job. It is my favorite, one of my favorite things to do. And I think a lot of doctors feel that way or would like to feel that way again, but can't. So I think that's something really important that the general public needs to hear. Like we care. It's just that we're stuck in this system. We all are driven by the insurance companies and big pharma to drive a wedge between doctors and patients. And that is the saddest part of being in healthcare today. Yeah, your doctor's not against you. It's just that your doctor's trapped in a system that is against you.
Yeah. Yeah, I mean, that's really powerful. I feel like I always hear you say too, like, especially to new patients coming in wanting to join our concierge practice, that your goal is actually to get them off all these unnecessary medications and
Oh
only on
yeah.
the medications that they desperately need.
Yes, yeah. And I think that's the goal of every no doctor wants to sit there and be writing prescriptions all day. Unfortunately, the system is created so that's the only way you can function in that traditional system. But I hate writing prescriptions. I hate putting people on medication. My goal is to have them take as little as possible and eventually get off and improve their lifestyle, do everything we can to get them off medications and be super healthy. That being said, there are people who really need if I'm writing you a prescription, it's because you really need it.
Yep.
So take it.
Yep. I love it. All right. What do you think is the most surprising thing you've learned from your patients?
I learn so much from my patients every day. I feel so lucky. You're gonna make me cry, Lauren. I feel so lucky to be in this job, to have this career. It's like the gift of a lifetime. It's just such a privilege to be able to like share so much with my patients, walk through them through some of the most challenging aspects of their lives and their happy moments too, and just to support them. So I've just seen people go through so many crazy, terrible things. And I think the resilience of the human spirit is what I've learned the most from my patients. Is like the shit people have had to endure and come out on the other side of is so inspiring and so powerful. And it inspires me. It gives me perspective. It allows me to be more present in my daily life so that I can be there for my family. Um, yeah, I think it's that resilience and that just, yeah. I had the opportunity to just meet some incredible people who I'm just in awe of every day. So, yeah.
Way to make me emotional too.
I know. I can't believe that.
Whenever you cry, I cry. I mean, I will say my office is right next to the primary care room, and all I ever hear when you're in office, I mean, you're always with patients for like an hour at a time, and I always hear laughter. We do have a tissue box in
Every
um
corner of the
every corner
office.
of this office, because I will say we get so deep and personal with our patients, and well, you do, and you learn so much about them, you learn from them, and I see the connection that you make with all of them every single day. It's like you get closer to them every single time you see them. And it's really beautiful. I know every doctor wants to provide this level of care. I wish this was more available everywhere, you know?
Yeah, me too.
Mhm. Yeah. Our last question, and then I wanna do a rapid fire question, and I actually feel like I already know what you're gonna say, but, how do you personally manage stress and burnout?
For me, I love exercise. I love being at the beach. I'm like an ocean baby. I love being in the ocean, near the ocean, seeing the ocean. I'm very fortunate that my office is 3 blocks from the ocean. So, pretty much every single day, I am walking on the beach, and it is like my grounding time. I sometimes listen to music, sometimes I listen to podcasts, sometimes I talk on the phone, sometimes it's total silence, but like I will be right there every afternoon. I probably walk like 30 30 to 40 miles a week, and it just instantly calms me and just kind of brings me back down. So that's really important to me, and I feel lucky to be able to live here and have that opportunity. If I can, I usually will jump in the ocean and swim afterwards for just like a couple of minutes, which is also really fun. That's kind of a new thing that I've been doing. Or I will walk in the water if the tide is good the whole time. I want to like be connected to the ocean. So that's my favorite thing. And then I'm very fortunate to have a really beautiful network of friends. I love being social with my friends, and that human connection is really important to me too.
Yeah. I will say every single day, like clockwork, you change into your workout clothes at the end of the day, and you just head off to the ocean. It's amazing.
Yeah,
It really is.
yeah.
I can attest, she does it every day. Okay, I'm gonna ask you some rapid fire questions. All right, coffee or tea?
Coffee.
Early
Yeah.
bird or night owl?
Well, come on. We know that. I am like a night owl to for all the night owls, but I'm working on getting better. So, yeah.
That's okay. Everyone operates on their own time.
Yeah.
Favorite wellness hack?
On this hack, like what do you mean by like a hack? I
I
don't
would
know.
probably say yours is like walking on the beach.
Yeah, okay.
Yeah.
Yes.
I feel like that's
Yeah.
your go-to.
That's my thing.
One health myth you wish would disappear tomorrow.
One that really gets me every time is that people think that mammograms cause cancer, mammograms prevent cancer. So that's one that just like makes my head spin.
If you could give everyone one piece of medical advice, what would it be?
So I think kind of back to what I said earlier, like advocating for yourself, especially as women. Women are more often dismissed and not heard in medical settings. And so advocating for yourself, if you feel something's off, if you feel something's wrong, if you need more time, ask for it, demand it, get it. I think that's the most important thing that people need to hear.
Yeah. Well, thanks so much for answering all these questions. This has been so fun.
Yes, it's way more fun than I thought it was going to be.
And I will say, I didn't give her any of these questions beforehand. So I did put her in the hot seat today for everyone
You
listening.
did. You did. I was looking for them. I'm like, where are they? You're like, you don't
Yep.
get them. I'm like,
Mm-hmm.
okay.
Yep.
That was good. Thank you,
Yep.
Lauren. Great job.
Yes. All right. Until next time.
Bye. Thanks for joining the Kind Revolution. If this gave you something real, hope, perspective, or a fresh way to think about health, please share it, subscribe, and pass it on. Medicine won't change on its own, but together we can reimagine it and build something smarter, kinder, and create a system that truly heals. This is the Kind Revolution with Dr. Nanos, where science meets compassion and the future of medicine gets brighter one conversation at a time. Thanks for joining the revolution.